go through everything. How are you feeling today? Good. Feeling pretty good? Are you having any pain? No pain? Awesome. Well, the doc is, I just received orders from the doc to insert that NG tube that we talked about earlier. Let me just finish washing my hands and I'll come discuss everything with you. So the doc, like I said, ordered that NG tube for you. It's a saline tube, and it just goes in your nostril, down into your stomach. It's going to help with helping with decompression in your stomach. It should make you feel better. It's a pretty quick procedure, but it's kind of uncomfortable. So I'm just going to sit you up here, okay? The doc also ordered it to be hooked up to low intermittent suction. Doing okay? Can you tell me your name and date of birth real quick? I know I asked you this 100 times. Yeah, okay. You're bending so well. All right. I'm gonna help you sit up just a little bit, okay? Perfect. I'm just gonna lower the side out so I have more working room. All right. So have you ever had any nasal surgeries? No? Perfect. What about a deviated septum? No? All right. Okay, so I'm just going to kind of get set up here. Let me see if let me grab some of this stuff real quick. Okay. So go ahead and open your mouth for me. Just look in there, make sure that there's no sores. Everything looks good. Your nares both look good. Do you have a problem with either side? Can you breathe good out of both sides, or is there one that's more difficult? No, they're both good? Okay. Perfect. All right. So, get you all set up here before we get started. Put this towel over your chest. Okay. And then I'm just going to listen to your belly real quick, okay? See if I can hear bowel sounds. Hold this down, hold this to keep you covered the best I can. I have the door shut so no one can see or hear anything. I'm just going to listen. Work quiet and see if I can hear anything. There's not very much going on down there. I can't hear much. Now I'm just going to lightly touch your belly, okay? Palpate all 4 quadrants. Is there any pain? No pain? Good. Just a little bit of distension? Perfect. All right. Okie dokie. So now I'm just going to get my stuff set up and then I'll be right back. Alright, so I'm going to hand you this just in case you feel like you're going to throw up or anything, okay? Alright, I'm going to wash my hands again real quick and I'll be right back. So I will wash my hands for another 20 seconds. Dry them. Alright, are you ready? Alright. So the first thing I'm going to do is grab gloves. I'm just going to check and see which side is better, okay, to use. I'm just going to fill your nose here real quick. Alright. Can you breathe in for me? Breathe in one more time. The right side feels better? Perfect. Okie dokie. but first we're gonna measure here. We're gonna go from the tip of your nose to your ear. Sorry, I'm gonna pull this down real quick. Down to your xiphoid process, which is about 60. Perfect. And so let me mark that real quick with a piece of tape. All right, and then I'm just gonna curl this around my fingers real quick just to make, oops, hold it off. Put this back at 60. Okay, just make sure that's curled real good. Need some lube so it goes in easier. Get it on the tube. Perfect. Leave that in there for just 2 seconds while I get the rest of my stuff together. Okay, so the doc does not have you NPO, so when we insert I'm going to stick the tube down into your nose, it's going to pass through your nasal pharynx, and once it gets down to the back of your throat, I'm going to have you take some sips of water. And that's going to help the tube go down into the correct place. If for some reason you feel any discomfort and you start coughing or gagging, make sure we'll stop, because it can possibly go into the lungs. That's one of the complications, and that's why we had you swallow the water to try to avoid that. If you do, for any reason, feel discomfort or anything, just make sure you raise your finger, or that will let me know that we need to stop, okay, or give you a break. All right? Perfect. Okay, are you ready? Make sure we have everything. I'm gonna actually, before we start, I'm just gonna make sure I set up my tape, because nobody wants to not have it when it's needed. Set that right there. Okay, and I'm gonna actually just hook up this tubing already so we have it when we need it. We won't turn it on quite yet, though. Okay, and we're gonna put this back up over you. Are you feeling okay? All right. So, there we go. All right. Have that out. I'm going to put the bottom of your tube in this basin just in case it starts to leak. And like I said, if you feel like you're going to throw up, just raise your finger and let me know, and we can use that basin for that as well, okay? So the first thing I'm going to have you do is I'm going to have you tilt your head all the way back. Perfect. That feel okay? All right, and I'm going to gently insert this into your right narrow, okay? Okay, take a big deep breath. It's going in. You're doing great. I'm going to get it right past the nasopharynx. Perfect. I'm just going to look in your mouth real quick. You're doing awesome. There's no gagging or coughing. Perfect. Now what I'm going to have you do is I'm going to have you hold this and take sips of water when I tell you to. Okay. I'm going to have you bend your head all the way forward, okay? Okay, take a sip. Swallow. Okay, another sip. Swallow. Perfect. This is going in great. No pain. No, good. Ready? Swallow. Okay. One more big swallow for me. Ready? Okay. Perfect. All right. I'm just going to secure this to your cheek real quick. Make sure it stays right at 60. Oops. Get that back in there, so just in case. There we go. Okay. Just going to look in here again, make sure everything looks good. Perfect. All right. Now, just going to, oops. I called for x-ray. They're coming, so before they get here, we're just gonna get a little bit of gastric secretions. I'm sorry, this keeps popping up. We'll get a better piece of tape for you. Does that feel okay? going to get my strip here. Let that sit for just a second. Okay. I'm going to measure. So the pH of your gastric content is 3, which is great. We want it under 5. So now I would hook you up to, let's see, I'm going to put this on here. This is just it helps so it doesn't leak all over you, okay? Let's see, that's there. Perfect. And before we can use this tube, we have to, let's just, okay. And like I said, before we can use this tube, we have to get x-ray to confirm placement. So we're not going to put anything in the tube right now. Once x-ray has been here and confirmed placement, we would hook it up to suction, low intermittent suction. I'm going to secure it to your nose. I know it's kind of uncomfortable. Are you doing okay? I don't want to let go of it. I'm sorry, I don't want to really jerk it around. So we're trying to be as smooth as possible, but sometimes difficult. There we go. That one side secured. So now wrap it around here. Alright, and I'm going to make sure that I mark the area of where it's at the nose with a red pen. I know where it's at. Okay. And then, are you feeling okay? Is there any nausea, anything like that? No? Alright. I'm just, now that it's hooked up to suction, I'm just going to palpate your abdomen one more time to see if you're still having distension. Oh, that feels better. Okay. And then we'll turn the suction. All right, and that's everything. I'll take this out here. Can you speak for me? Perfect. Okay. Get comfortable. And then just look at this one more time here. All right. No complications. So we have to make sure we keep the head of your bed at least 30 degrees at all times, okay? So I'll lay it back a little bit, and I'll show you where we can. Actually, and is it being secured? That's about 30 degrees. Let me secure that to your gown as well. And at this time, I don't have my rubber band or safety pin, so I would go have my assistant get it for me, and then I would secure the tube securely to the patient's gown. I'd have them look to the opposite side and make sure there's enough slack so it doesn't pull. And then I'm going to lower the bed. And there's your call light. If you need anything, you let me know. If you end up with any pain, I know there's a little bit of discomfort, but any pain, you make sure you push your call button and I'll come in, okay? Have a good day.